Hello, you're watching Eye on Africa with me, Yana Lee. Tonight, it's day one of a 3-week lockdown in Zimbabwe, a country that was already suffering from a devastating economic recession. Abuja and Lagos also joined the global stay-at-home movement. Nigerian President Muhammadu Buhari has ordered a 2-week lockdown in an attempt to slow down COVID-19. And in Tunisia, students and businesses are rushing to find new solutions to help the country deal with the coronavirus pandemic. It's day one of a 3-week lockdown in Zimbabwe. In the capital, most people stayed at home after police emphasized that those who don't comply will be prosecuted. Rights groups, though, warn that many living in low-income suburbs won't have enough food and water to last 21 days. So far, the country has recorded around 10 positive cases of the coronavirus out of the some 200 people tested. For the latest, we can cross now to our correspondent in Harare, Ryan Truscott. Hello, Ryan. Tell us, how is the lockdown going so far?
Well, it's been widely heeded, at least in the urban areas. Harare's streets were eerily quiet today. Banks, businesses, and open-air markets were all shut and deserted. Similar pictures were coming out from other cities and towns throughout the country, and police had threatened to arrest anybody who violated the lockdown. Thousands of people actually left Harare and other cities over the weekend because they felt that they were better off fending for themselves and their families in rural villages where they might be able to find more food. But the worry is that they may unwittingly be carrying the virus to those areas which have very little in the way of health facilities.
Indeed. Now, won't this be disastrous for the majority of Zimbabweans who don't have steady jobs?
Absolutely, yes. I mean, most people here are self-employed. Yet it's only the food markets that are allowed to operate. And that's raised fears that people are going to be starving in their homes and that eventually they'll be forced to defy the lockdown to go and try and earn a living. A coalition of rights groups, the Zimbabwe Human Rights NGO Forum, says that people weren't given enough time to prepare for this lockdown, and it's worried that people are going to be starving in their homes and that they won't have enough food and enough water to last the entire 21 days. The government has today said it'll make small cash payments to 1 million vulnerable households over the next 3 months, but it's not clear if they've got a comprehensive database that'll ensure that everyone in need gets the help they require. And of course, the impact on the economy in general has been massive. Already, the tourism industry has been hard hit. A number of hotels have closed down. Zimbabwe was in the middle of an economic crisis before this public health crisis arose. And so this is going to make things decidedly worse.
All right, that's all we have time for. A situation we will be following there. Thank you so much, Ryan Truscott, reporting for us there in Harare. Neighbouring South Africa, too, has opted for a 3-week lockdown. We're 3 days into that now, and authorities are struggling to enforce confinement rules. The country's defence minister apologised today after videos surfaced of soldiers allegedly abusing citizens. The army has been helping to police streets across the country. In a separate case, a police officer and a security guard shot dead one man accused of resisting arrest and violating the lockdown. South Africa has the most confirmed cases of coronavirus on the continent, with over 1,250 people testing positive. But for many, poverty trumps fears of the virus. Nigerian President Muhammadu Buhari has announced a 2-week lockdown in 2 cities. Movement will be restricted in the capital, Abuja, and the biggest city, Lagos, starting 11 p.m. local time on Monday. Nicolas Germain has the latest.
The city of Lagos had already closed schools and non-food shops, but many were surprised when President Muhammadu Buhari announced a 2-week total lockdown for Lagos and Abuja starting Monday evening.
We're not fully prepared because the economic situation in Nigeria is not really good. It's very poor. Things are more costly than before. We only have enough foodstuff at home to take care of the family. The 2 weeks is too long.
Many Nigerians said they were less worried about coronavirus and more about how they could buy food for 2 weeks when they often have to rely on daily earnings to survive.
They invite us to sit at home. They have to provide what we are going to need for us. As we are inside the house, no food for us. You see many people at the house and no money to buy nothing for them. No store food. We don't have anything to eat at our house.
Social distancing will not be easy to implement. On average, there are nearly 5 people in every Nigerian household, compared to 2.5, for example, in South Korea. Many Nigerians said Buhari's announcement lacked clarity. He banned all movement, but said food shops would remain open. He did not say if ordinary citizens would be allowed to go to these shops during the next 2 weeks.
Now, as you just saw, the authorities across the continent are having to strike a balance between containing the coronavirus and economic survival. In Cameroon, too, millions rely on daily wages to survive. So far, there are over 100 people there who have tested positive for COVID-19. The government has banned large gatherings and limited movement. In reality, many can't or won't follow the rules. Our correspondents on the ground sent us this report.
It is a usual day in the capital of Cameroon at this busy bus station. It is rush and despite the threat of coronavirus, men and women are ready to board these minibuses connecting the city center to the outskirts of Yaoundé. Hand washing seems to be the only COVID-19 preventive measure respected by passengers like Jacques, who are crowded in this minibus commonly called cargo without face masks or gloves. This transport system is preferred by many because it is affordable.
Le cargo c'est le moins cher, 300 et on arrive. Par rapport au taxi, pour quitter d'ici à Soir, c'est trop cher.
A few meters away, we are at one of the most popular markets in the city. The lack of respect of COVID-19 preventive measures is visible. It's hard to maintain social distancing in this market, which has many shops. Shop owners like Jeannette say they cannot keep their businesses closed. She counts on her sales to provide for her family.
En ce qui concerne cette maladie, on a de la peine à respecter les 1 mètre qu'on demande. Parce que surtout le matin, il y a de l'affluence. Si l'État nous laisse tous à la maison, de rester à la maison, on va nourrir les enfants comment? Il n'y a pas l'argent.
Faced with this refusal by most Cameroonians to comply, the National Gendarmerie has taken steps to enforce the confinement decreed by authorities. Now, there is neither general curfew nor total confinement, but security forces are bent on having Cameroonians respect the measures and bet on their sense of responsibility.
Nous nous sommes rendus compte que les populations n'adhéraient pas totalement. Il y en a qui adhèrent, il y en a, mais pas totalement à ces instructions. C'est pourquoi nous avons un peu durci le ton.
While the COVID-19 pandemic continues to spread in Cameroon, the government has called on security forces to ensure the strict respect of measures put in place to curb the spread of the virus.
3D printers to make masks, robots to help police officers stay a safe distance away from citizens. Engineers and entrepreneurs are rushing to find creative solutions to help stop the COVID-19 outbreak. Our next report takes us to Tunisia. The North African country has been under lockdown for more than a week now. But behind the scenes, businesses and students are stepping up to stem shortages. France 24's Lilia Blaise and Hamdi Talili went to meet the people behind the ideas.
It's not a science fiction movie, but a scene in Tunis during lockdown. This robot is remote controlled from a distance by the Interior Ministry. It roams the streets to police people's movement. Still in its testing phase, the ministry didn't allow our cameras to film the robot. But for citizens who encounter it, the exchange usually goes smoothly. The robot was donated by a Tunisian startup. It was originally made for export, but since the arrival of coronavirus in the country, many Tunisians are volunteering to help. In this engineering school in Sousse, this student was one of the first to start producing visors for medical personnel.
Les pièces découpées en laser, puis on prend ce film-là et à son vitesse, comme ça. On peut fabriquer jusqu'à 400 à 500 masques par jour. Donc ce modèle est flexible.
In another room, 3D printers are making prototypes for artificial respirators, another essential equipment for doctors. We leave for Hammamet, a tourism hub, where hotels are closed and the sector is facing challenges. But hotel owners have opened their doors for repatriated Tunisians and doctors who have to isolate themselves away from family.
Ils doivent être sur une seule unité, l'hôtel de confinement du corps médical. Aujourd'hui, il y a des exigences qui sont supérieures à l'activité de chacun. Aujourd'hui, c'est la santé des Tunisiens et de la Tunisie et des étrangers qui sont en Tunisie.
Every day, this hotelier coordinates with his federation to buy materials for hospitals, a civic mobilization to plan ahead for the arrival of more cases of COVID-19.
That's it from me for now. Do stay tuned for more international news coming up right here on France 24.